can't see any patient that Here to Help would not be appropriate for. I think it would help all of them. My name is Brian Rogers. I practice in Bountiful, Utah. That's just north of Salt Lake City. I have been practicing there for nearly 10 years and have been using Suboxone to help my patients for the last 5 years. When I first heard about the Here to Help program, I didn't want much to do with it. I didn't need another program, more work for me and my office staff to implement someone else's program. But I've come to find that it's been a great support to me in my practice. It decreases my time in the room with the patient because they have a general understanding of what they need to do. My patients are more successful with the Here to Help program. Number one, they come more prepared to their office visits and they know what to ask. Sometimes as a physician, I think they understand everything I'm saying and they smile and nod, but they may not know what's happening. The Here to Help program helps reinforce the things that I'm teaching the patient. When our patients come for their first visit, before their induction visit for Suboxone, one of the things I do is talk to them about the Here to Help program. Once they've left the physician's office, their mind is on something else and they put off making that phone call to Here to Help. So to get them to do it right there in the office assures that they get set up in the program, and they've been very happy that we've done that. My patients have benefited from the Here to Help program and having a care coach who's been there to back them up, to help them, to kind of coach them along the way. They've received emails with information. They have access to a website with information. We encourage our patients to use their success planner to keep their journal and to write any questions that they have for me for their upcoming appointments. They come more prepared to the visit because they have questions that they've written down and there's specific information that they've been prompted to ask and find out. For example, what do they do if they relapse? I feel that the care coach helps these patients to be motivated in their treatment. It helps facilitate and hasten their progress. I would encourage my colleagues to use the Here to Help program. With Suboxone treatment, it's great to have as much support for these patients as possible. Their physician might be one leg of a stool. Their counseling and outpatient treatment may be another leg of the stool. Here to Help is probably a third leg in that stool. The Here to Help program has helped my practice in helping me to be a more efficient provider because there's more quality in the visit. I've had better prepared patients. My staff and myself have had to put less time into these patients, and I've seen greater success with this patient population.
Important safety information. Suboxone, buprenorphine, and naloxone sublingual film C3 is indicated for maintenance treatment of opioid dependence as part of a complete treatment plan to include counseling and psychosocial support. Treatment should be initiated under the direction of physicians qualified under the Drug Addiction Treatment Act. Suboxone, buprenorphine, HCl, naloxone, HCl, dihydrate sublingual tablets, C3, is indicated for the treatment of opioid dependence. Suboxone sublingual film and Suboxone sublingual tablets should not be used by patients hypersensitive to buprenorphine or naloxone. Suboxone sublingual film and Suboxone sublingual tablets can be abused in a manner similar to other opioids, legal or illicit. Clinical monitoring appropriate to the patient's level of stability is essential. Chronic use of buprenorphine can cause physical dependence. A sudden or rapid decrease in dose may result in an opioid withdrawal syndrome that is typically milder than seen with full agonists and may be delayed in onset. Suboxone sublingual film and Suboxone sublingual tablets can cause serious life-threatening respiratory depression and death, particularly when taken by the intravenous IV route in combination with benzodiazepines or other central nervous system CNS depressants, such as sedatives, tranquilizers, or alcohol. It is extremely dangerous to self-administer non-prescribed benzodiazepines or other CNS depressants while taking Suboxone sublingual film or Suboxone sublingual tablets. Dose reduction of CNS depressants, Suboxone sublingual film, and Suboxone sublingual tablets, or both, when both are being taken, should be considered. Liver function should be monitored before and during treatment. Death has been reported in non-tolerant, non-dependent individuals, especially in the presence of CNS depressants. Children who take Suboxone sublingual film or Suboxone sublingual tablets can have severe, possibly fatal respiratory depression. Emergency medical care is critical. Keep Suboxone sublingual film and Suboxone sublingual tablets out of the sight and reach of children. Intravenous misuse or taking Suboxone sublingual film or Suboxone sublingual tablets before the effects of full agonist opioids, for example heroin, hydrocodone, methadone, morphine, oxycodone, have subsided, is highly likely to cause opioid withdrawal symptoms. Neonatal withdrawal has been reported. Use of Suboxone sublingual film or Suboxone sublingual tablets in pregnant women or during breastfeeding should only be considered if the potential benefit justifies the potential risk. Caution should be exercised when driving vehicles or operating hazardous machinery, especially during dose adjustment. Adverse events commonly observed during clinical trials and post-marketing experience for Suboxone sublingual tablets are headache, nausea, vomiting, sweating, constipation, signs and symptoms of withdrawal, insomnia, pain, and swelling of the limbs. Adverse events commonly observed with the sublingual administration of Suboxone sublingual film are numb mouth, sore tongue, redness of the mouth, headache, nausea, vomiting, sweating, constipation, signs and symptoms of withdrawal, insomnia, pain, swelling of the limbs, disturbance of attention, palpitations, and blurred vision. Cytolytic hepatitis, jaundice, and allergic reactions, including anaphylactic shock, have been reported. This is not a complete list of potential adverse events associated with Suboxone sublingual film and Suboxone sublingual tablets. Please see full product information for a complete list. To report an adverse event associated with taking Suboxone sublingual film or Suboxone sublingual tablets, please call 1-877-782-6966. You are encouraged to report adverse events of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.